Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about maternal death audit. So go ahead, subscribe, and let's get started. Students, now let us understand what maternal death means. Maternal death refers to the death of a woman while she is pregnant, or within 42 days after the pregnancy ends. The pregnancy may end through childbirth, abortion, miscarriage, or any other form of termination. It is important to note that the duration of pregnancy does not matter. The death can occur at any stage of pregnancy or within 42 days after its termination. For a death to be classified as a maternal death, it must be related to the pregnancy itself or be caused by a condition that was made worse by the pregnancy or its management. However, deaths that occur due to accidental or incidental causes are not considered maternal deaths. For example, if a pregnant woman dies in a road traffic accident, it is not classified as a maternal death. In simple terms, maternal death is the death of a woman during pregnancy or within 42 days after the end of pregnancy due to causes related to pregnancy, childbirth, or their management. Now let us understand the definition of maternal death audit, commonly known as MDA. Maternal death audit is a systematic and confidential review of maternal deaths. In simple terms, it is a detailed analysis conducted whenever a maternal death occurs. The purpose of this review is not to blame anyone. Instead, it helps healthcare professionals understand what happened and identify the factors that contributed to the death. These factors may be medical factors, such as severe bleeding, hypertension, or infection. They may also be non-medical factors, such as delay in seeking care, transportation problems, lack of awareness, or delay in receiving treatment. By carefully reviewing each maternal death, healthcare teams can identify gaps in care and learn important lessons. The information obtained from the audit is then used to improve the quality of maternal healthcare services and prevent similar deaths in the future. According to the World Health Organization, a maternal death audit is an important process that helps healthcare providers understand why a mother died during pregnancy, childbirth, or within 42 days after the end of pregnancy. By carefully reviewing each case, healthcare teams can identify medical causes as well as delays or problems in care that may have contributed to the death. The information gathered from the audit helps in planning corrective measures, improving the quality of maternal healthcare services, and preventing similar maternal deaths in the future. Now, let us discuss the objectives of a maternal death audit. The first objective is to identify the causes and contributing factors of maternal deaths. This helps us understand why the death occurred and what factors played a role. Another objective is to assess the quality of maternal healthcare services. By reviewing each case, healthcare providers can evaluate whether appropriate care was given at the right time. Maternal death audit also helps detect avoidable and preventable factors. In many cases, delays in seeking care, reaching a health facility, or receiving treatment may contribute to maternal deaths. Based on the findings, corrective actions can be recommended. These actions help improve healthcare practices and prevent similar incidents in the future. The audit also aims to improve maternal health outcomes by ensuring safer pregnancy, childbirth, and postnatal care. An important goal is to reduce the maternal mortality ratio, or MMR, which is a key indicator of maternal health in a community or country. Finally, maternal death audit strengthens accountability in healthcare services by encouraging healthcare providers and institutions to continuously improve the quality of care they provide. Now, let us discuss the importance of maternal death audit. Maternal death audit plays a major role in preventing future maternal deaths. By studying each maternal death carefully, healthcare providers can learn valuable lessons and avoid similar incidents in the future. It also helps improve clinical practices and standards of care. The findings from the audit guide healthcare professionals in providing safer and more effective maternal healthcare services. Another important benefit is that it enhances communication among healthcare providers. Doctors, nurses, and other healthcare team members work together to identify problems and find solutions. Maternal death audit also helps identify gaps in the referral system. such as delays in transferring patients or difficulties in accessing higher levels of care. The information collected from audits supports evidence-based decision-making. This means that decisions are made based on real data and findings rather than assumptions. Finally, maternal death audit helps health authorities develop better policies and plan effective maternal health programs. So, in simple terms, maternal death audit is important because it helps prevent maternal deaths, improves the quality of care, strengthens teamwork, identifies healthcare gaps, and supports better planning for maternal health services. Now, let us discuss the different types of maternal death audit. Maternal death audits can be conducted in different ways depending on where the death occurred and what information is needed. First, let us look at facility-based maternal death audit. This type of audit is conducted in hospitals or healthcare institutions. It includes reviewing all maternal deaths that occur within the healthcare facility. The main purpose is to assess the quality of care provided to the mother before her death. One of the major advantages is that hospital records, case sheets, and investigation reports are easily available. This helps healthcare providers quickly identify problems or gaps in the services provided and take corrective actions. Next is community-based maternal death audit. This type is conducted when maternal deaths occur at home or within the community. Healthcare workers collect information by interviewing family members, community health workers, and others who are involved in the woman's care. This audit helps identify social, cultural, economic, and transportation-related factors that may have contributed to the death. It also helps detect delays in seeking medical care or reaching a healthcare facility. The third type is confidential inquiry into maternal deaths, commonly called CEMD. In this method, selected maternal deaths are investigated in detail by a team of experts. The review is conducted anonymously, meaning the names of the mother, healthcare providers, and institutions are kept confidential. The purpose is not to find fault or blame anyone. Instead, the focus is on understanding what happened, learning important lessons, and recommending improvements to prevent similar deaths in the future. Finally, let us discuss near-miss audit. A near-miss case refers to a woman who experienced a life-threatening complication during pregnancy, childbirth, or the postpartum period, but survived. In a near-miss audit, these cases are carefully reviewed to understand what helped save the woman's life. This type of audit helps identify both the strengths and weaknesses of the healthcare system. Since these women survive, healthcare providers can learn valuable lessons about effective management and improve the quality of maternal care. Now, let us discuss the components of a maternal death audit. These are the important steps followed while conducting an audit. The first component is the identification of maternal death. Whenever a maternal death occurs, it should be notified and reported to the appropriate authorities. After reporting, the death is verified to confirm that it meets the criteria of a maternal death. The next component is data collection. This is a very important step because accurate information is needed for proper analysis. Information is collected from medical records, case sheets, referral notes, laboratory reports, and other relevant documents. Interviews may also be conducted with family members, healthcare workers, and others involved in the care of the woman. After collecting all the information, the case review is carried out. A multidisciplinary team, which may include doctors, nurses, administrators, and public health experts, carefully reviews the case to understand what happened. The next step is the identification of contributing factors. The team looks for medical causes such as hemorrhage, hypertension, or sepsis. They also identify system-related causes such as delays in referral, lack of resources, or inadequate treatment. Social factors such as poverty, lack of awareness, transportation problems, and cultural practices are also considered. Based on the findings, recommendations are made. These recommendations focus on corrective actions that can improve the quality of care and prevent similar maternal deaths in the future. The final component is follow-up. It is not enough to simply make recommendations. Healthcare authorities must monitor whether the recommendations are actually implemented and whether they lead to improvements in maternal healthcare services. So in simple terms, the components of maternal death audit include identifying and reporting the death, collecting information, reviewing the case, finding contributing factors, making recommendations, and following up to ensure improvements are made. Students, one of the most important concepts in maternal death audit is the 3 delays model. This model helps us understand why maternal deaths occur and where interventions are needed to save mothers' lives. The first delay is delay 1, which is the delay in deciding to seek healthcare. In this situation, the mother or family members do not recognize the seriousness of the problem or delay the decision to seek medical help. This may happen because they are unaware of danger signs during pregnancy, labor, or the postnatal period. Cultural beliefs and traditional practices may also influence the decision to seek care. Financial difficulties and the low status of women in some families can further delay timely healthcare seeking. The second delay is delay 2, which is the delay in reaching a healthcare facility. Even after the decision to seek care has been made, the mother may face difficulties in reaching a hospital or healthcare center. Lack of transportation, poor road conditions, and long distances to healthcare facilities are common reasons for this delay. As a result, valuable time may be lost before the mother receives medical attention. The third delay is delay 3, which is the delay in receiving adequate care at the healthcare facility. In this situation, the mother reaches the hospital, but there are delays in providing appropriate treatment. This may happen because of a shortage of healthcare staff, lack of essential equipment, medicines, or blood products. Delayed diagnosis, delayed treatment, and poor referral systems can also contribute to this delay. Understanding these 3 delays is very important, because most maternal deaths can be prevented by addressing these barriers. By improving awareness, transportation, healthcare facilities, and the quality of care, we can significantly reduce maternal mortality. Students, now let us discuss the steps involved in conducting a maternal death audit. This is a systematic process that helps healthcare teams understand why a maternal death occurred and how similar deaths can be prevented in the future. The first step is notification. Whenever a maternal death occurs, it should be reported within 24 hours. Early reporting ensures that important information is not missed and allows the audit process to begin promptly. The second step is data collection. During this stage, all relevant information related to the case is gathered. This includes medical records, case sheets, laboratory reports, referral notes, and information from family members or healthcare providers. The third step is the review meeting. A multidisciplinary team consisting of doctors, nurses, administrators, and other healthcare professionals comes together to review the case in detail. The purpose is to understand the sequence of events that led to the maternal death. The fourth step is analysis. The team carefully examines the collected information to identify the direct causes of death, contributing factors, and any avoidable or preventable issues that may have played a role. The fifth step is making recommendations. Based on the findings, the team develops practical action plans to address the identified problems and improve maternal health care services. The sixth step is implementation. At this stage, the recommended corrective measures are put into practice. This may include staff training, improving referral systems, ensuring the availability of equipment, or strengthening clinical protocols. The final step is monitoring and evaluation. The healthcare team assesses whether the implemented changes are effective and whether they have improved the quality of care. Continuous monitoring helps ensure that the recommendations lead to meaningful improvements. So, in simple terms, the steps of maternal death audit are notification, data collection, review meeting, analysis, recommendations, implementation, and monitoring. Each step is important in helping us learn from maternal deaths and prevent similar deaths in the future. Students, nurses play a very important role in maternal death audit. Since nurses are directly involved in the care of mothers during pregnancy, labor, and the postnatal period, they can contribute significantly to preventing maternal deaths. One of the first responsibilities of the nurse is the early identification and reporting of maternal deaths. Timely reporting ensures that the audit process can begin without delay. Nurses are also responsible for maintaining accurate and complete patient records. Good documentation provides valuable information for understanding what happened and helps the audit team analyze the case correctly. Another important role is participating in audit meetings. Nurses share their observations and experiences related to the care provided to the mother, which helps the team gain a complete picture of the case. Nurses also assist in collecting relevant data, such as patient history, nursing records, treatment details, and information related to the mother's care. During the audit process, nurses can help identify gaps in nursing care, such as delays in monitoring, communication issues, or areas where care can be improved. Once recommendations are made, nurses play a key role in implementing them. This may include improving nursing practices, following updated protocols, and participating in training programs. Health education and counseling are also important nursing responsibilities. Nurses educate mothers and families about danger signs during pregnancy, the importance of regular antenatal care, and when to seek medical help. Finally, nurses help strengthen referral and follow-up services. They ensure that high-risk mothers are referred appropriately and receive continuous care and monitoring. Students, now let us discuss the benefits of maternal death audit. One of the most important benefits is the reduction in maternal mortality. By identifying the causes of maternal deaths and taking corrective actions, many future deaths can be prevented. Maternal death audit also helps improve the quality of obstetric care. Healthcare providers can identify weaknesses in the system and make necessary improvements in patient management and treatment. Another benefit is better clinical decision-making. The lessons learned from previous cases help doctors and nurses make faster and more effective decisions when managing high-risk mothers. It also enhances teamwork among healthcare professionals. Doctors, nurses, administrators, and other healthcare workers work together to review cases, discuss challenges, and find solutions to improve care. Maternal death audit strengthens the overall health system by identifying gaps in services, referral systems, staffing, equipment, and resource availability. Finally, it increases patient safety. By improving healthcare practices and preventing avoidable errors, mothers receive safer and more effective care during pregnancy, childbirth, and the postnatal period. Now let us discuss the challenges faced in maternal death audit. One of the major challenges is underreporting of maternal deaths. Sometimes maternal deaths are not reported properly, especially when they occur at home or outside healthcare facilities. This can lead to incomplete data and affect the accuracy of the audit. Another challenge is incomplete medical records. If patient records are missing important information, it becomes difficult to understand the exact events that led to the maternal death. Fear of blame is also a common problem. Some healthcare workers may hesitate to participate openly in the audit because they worry about criticism or punishment. However, it is important to remember that the purpose of the audit is to learn and improve care, not to blame individuals. Lack of trained personnel can also affect the quality of the audit. Properly trained healthcare professionals are needed to collect data, analyze cases, and make appropriate recommendations. Resource constraints are another challenge. Limited staff, inadequate infrastructure, lack of equipment, and insufficient funding can make it difficult to conduct audits effectively. Finally, poor follow-up of recommendations can reduce the impact of the audit. Even when important problems are identified, improvements may not occur if the recommendations are not implemented and monitored properly. That's the end of this video. If you liked this video, don't forget to like, share, and subscribe to my channel for more nursing learning videos. Thank you for watching, and keep learning.